Degenerative scoliosis is one of the most common types of scoliosis that we tend to see in adult patients. Now, when we look at adult patients and scoliosis, there's really two main types, but degenerative scoliosis is one of the ones that actually occurs in adults. The second type is something called idiopathic scoliosis that goes either undiagnosed or they knew they had it as an adolescent, and now that adolescent now becomes an adult. That we call adolescent scoliosis in the adult stage. However, adult degenerative scoliosis is a scoliosis that actually occurs in adult stages. And this degenerative scoliosis, it has two main things that are associated with it. It can be changes in bone density, meaning that the adult patient will have a change in bone density, which can lead to slight compression fractures of the spine, which lead to degeneration of the bone tissue, which can actually create a curvature to occur. Second reason, there tends to be some association with hormones that happen during menopause, hormonal changes that happen during menopause for women, in their 50 to 55 years of age, that this change, this menopause change, can be associated with the causation of progression of scoliosis. The second thing, and the last thing here, the third thing is something called traumatically induced scoliosis, meaning a trauma can happen to the spine, which can cause the spine to shift. It remains uncorrected. It can lead to spinal degeneration, which can lead to scoliosis. All three of those types occur in adult stages. So when we look at degenerative scoliosis, we normally would associate that mostly with an adult. However, adolescent scoliosis in the adult also go through a degenerative phase as they get older and can look like degenerative scoliosis that occurred in adult later on in life. So sometimes when we see a patient that didn't know if they had scoliosis as a child, and we're looking at them at 60 years of age, and we see a lumbar curve that looks degenerative, it's unclear or unknown whether that person may have had a small curve that was maybe 15 degrees, that didn't get diagnosed, that progressed slowly in the midlife and started progressing faster as they got older, and now they got a 40 or 50 degree curve. There's no way of really knowing, did it really occur at the adult stage, or was it something that was undiagnosed? Either way, the symptoms are the same when we look at adult degenerative scoliosis. First thing is that there tends to be a loss of height. Now, this is a lot of patients say, well, am I really getting smaller? Well, kind of. Your spine is kind of compressing. And when you get a curvature that starts to occur, it decreases the total length of your spine, meaning that because of the curve that starts to occur. Also, it tends to be pain. Mostly lumbar low back pain is the most common type. And normally it's pain that increases in the evening, and it normally feels better in the morning. So it's pain that increases with activity and time. This pain can unfortunately worsen as the curve gets bigger, and it causes more and more problems. In addition, it can not only be low back pain, but it can be neck pain. Neck pain can cause these problems as well. When you have scoliosis, you can start to feel neck pain and headaches. One big issue is because as this curve is degenerative, it starts to limit mobility of the spine and flexibility. So patients will start to feel stiffer. They don't have the same flexibility, they don't have the same mobility that they had when they were younger. That can be very associated with degenerative scoliosis. So if you think you have degenerative scoliosis, or you do, you have a friend or family member that has degenerative scoliosis, what are some things that you should definitely understand? Number one is that it's always going to progress. Now, why can I say almost always it's going to progress? Because what's causing the progression is gravity. Gravity is putting pressure down on an asymmetrical degenerative spine. It's like kind of gravity putting down on an asymmetrical car. It's going to cause that tire to degenerate, and it's not going to stop until you realign that car. It's the same thing that happens with this degenerative type of scoliosis. It's a progressive problem. It does not go away on its own, and more likely it will continue to worsen. And as it continues to worsen, it causes more and more issues. If it's unfortunately, as these curves can get severe, they can start affecting your ability to be mobile. And this is very important for doctors when we see patients as they get older and curves get bigger, and they're having a hard chance actually starting to stand up and walk. That's a very important factor, because when older patients can't stand and walk, it's very important for their longevity to be able to stand and walk. So we take that very important. So we think it's very important to seek treatment early, and to not let that curve continue to progress and the degeneration to get worse. So how do we take care of scoliosis, especially degenerative scoliosis, in a patient that we know that it could be progressing or we're concerned about progression? Well, first of all, we define our treatment plan as something called a functional treatment plan. That our goal is to try to restore function back into the spine. So number one, the spine can be strong enough to stabilize itself. The treatment plan typically associated with degenerative scoliosis on the traditional option is normally just pain management. It's pain pills, injections, those types of things. And there's nothing really to manage the scoliosis. So the curve is still degenerating, it's still worsening, it's still getting worse. With a functional treatment plan, since we're trying to restore function and actually reduce the curve, we're actually trying to slow down and stop the degenerative scoliosis from continuing to progress and preserve the patient's ability to perform and do things. So our core program falls around 4 main things that we want to do, or modalities. Number one is chiropractic care. Chiropractic care is the hub, but it's not just the program that we use. We use specific chiropractic care that's designed for scoliosis patients to help reduce misalignments and help patients deal with the pain that they may be experiencing as a result of the degenerative scoliosis. We do something called SSTs, which is scoliosis-specific therapy and rehabilitation. The scoliosis-specific exercises or rehabilitation is done in the office. And this therapy and this rehab is designed to help increase flexibility of a degenerative scoliosis, reduce the curve, reduce nerve pressure, and allow the chiropractic care to be more effective as well. Because as you increase flexibility of the spine, the adjustments that are performed with the chiropractic care can be more effective. In addition, we do something called home therapy and home exercises. So a lot of the office therapy we can condense down into a simpler program, and we give home therapy and home rehab for patients to do in coordination with what they're doing in the office. In addition is that we do something called scoliosis-specific exercises. These are customized prescribed exercises that are done for a scoliosis patient. They can be done globally, which is what we call SSEs, scoliosis-specific exercises, and we also use something called isometrics that are designed to stabilize a scoliosis patient. And then lastly is a lot of times we can even use something called a ScoliBrace or a scoliosis brace. These braces are designed in a corrective manner to help reduce the curve, not just squeeze it and immobilize it. With these combination of treatments, we're successful in actually reducing scoliosis patients' curvatures even in late stage life. The oldest patient ever taken care of with scoliosis has been a 95-year-old nun with 120-degree scoliosis, and we were actually able to reduce her scoliosis significantly below 100, and now she was actually still maintaining that reduction to this day, which is, I'm happy to say, well, to this day being 2021. I also want you to understand that we have great results in reducing pain and improving mobility and reducing curves in patients with all ages. Again, from 95 years of age, it was the oldest patient I've taken care of, to the youngest patient I've seen have been infants. So we have great results in doing this. The results are to not only make patients feel better, but most importantly is to reduce the curve. Because if we can reduce the curve, then a patient will not only feel better, but they're going to actually be better, because their curve is smaller, and that means we're slowing down that degenerative stage of their scoliosis problem. So first of all, if you think that's what's happening, be evaluated properly, find a doctor that is experienced in treating scoliosis, and make sure that you're getting a complete program that's going to help reduce the curve over time. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.